thresholds whereby certain interventions are required, monitoring against those thresholds, and then triggering surge support, providing the surge support, and then scaling it down when the caseload decreases. So again, we just set the thresholds like that. So if you look there, normally you might have under 10 cases at a particular health centre, and it's just your normal system strengthening, so you might be supporting the better management of the health services locally. Then on alert, you're looking at an increased caseload, you're intensifying your mentoring, you're focusing on crucial gaps, maybe looking at hotspots, and you're maybe doing extra training on staff. When it gets to a serious level, you're looking at implementing short-term solutions to overcome gaps. You might be seconding a staff to deal with that. And then in emergency, obviously, you're talking about maybe direct implementation by supporting NGO, etc., etc. So I think it's quite interesting to look at it in this way, that it's a systematic setting of these thresholds and then identifying the caseload that goes for it, or the interventions that are required to support it. This is very much defined at district level. You need to agree it in advance, formalise it in an MOU, and then fund it. So that's basically the surge capacity model. It's one that we're probably least advanced on. That's our thinking at the moment. We're looking at doing this in Kenya and probably in Niger. We do not have a partner yet to look at the research component of it. It's going to be a mix of qualitative and quantitative research. The previous one, CRAM, actually, just to say to you, the research is being done by the Feinstein International Centre at Tufts University, working on that with us. The last model I want to talk about is a graduation model, and this gets away from a little bit from the hunger and nutrition agenda. But this one is really around getting the ultra-poor onto the production ladder, and is based on BRAC's targeting the ultra-poor model. We've done work in Haiti on this for a number of years, and there was a major conference, obviously, in graduation in Paris in October last year. The concept has been proven. If you invest in people, destitute people, you give them the skills training, give them assets or stipends and social protection for a period of time, they can get out of poverty. They can get themselves onto the productive ladder. But there are major costs involved. We found that I think that the average cost of these was something like $2,000 per beneficiary. The problem with that, I think, is around scale up by government. Can it afford that level of resources to get people at the bottom of the ladder onto the ladder? We're going to be doing this particular piece of research in Burundi and Rwanda. Our partner, research partner is Stephen Devereaux from the IDS in Sussex, who's well known in this area. And we're working implementing directly in Burundi and then with the government in Rwanda. Basically, what I think is interesting about this particular model is that we're trying to answer a question about value for money and how to make this more affordable for government. Again, we know what the model is. I think it has been accepted that it works. So, you're training people, you're giving them social protection for the best part of 18 months or 2 years, so that they don't have to go and look for food or spend their time doing elsewhere. They can actually build a skill base. You're giving them assets, and you're helping them to set up a new business. What we found with it was, I think one of the things that came out of the conference in Paris last year was that the coaching element of this was something that was quite costly. You have intensive mentoring for a long period of time, and it actually is quite expensive. And what we're trying to do is look at a less intensive coaching support and see whether it actually could make the model more cost effective. I think that's a very interesting one, because it is all about the ability to afford this and value for money in relation to it. Yeah, I suppose just a final few words. I mean, they're the four models we're investing in. We're doing a lot of other interesting work with the bank. We've been supporting the National Solidarity Program in Afghanistan, where we've actually been doing an awful lot of pilot projects and bringing female councils to light, which were never there before. We've been doing a lot of work on infant and young child feeding in Ethiopia with the bank. So, our cooperation with the bank has been increasing, I think, over the years. I think what I suppose the parting words I'd leave with before I hand back to Tom is that we are committed to learning and evidence creation. We're investing in a high-level action research, but in flagship programs, and that's fine. We're not going to do it everywhere, as I said earlier. We do want to work with partners with capacity to influence, and that's why our work with researchers, I think, is becoming more and more important. Importantly, and I'm meant to be directing advocacy and concern as part of my title, as Tom explained, I want our advocacy to be solution-based. not just to be ideological or complaining about bank policies or this or that. I think as an NGO, we work on the ground, we're implementers. What we should bring to the table is this works here, and an understanding. You know, we are a very grounded organisation, and I think that's what we should bring to the table. We want to be a leading agency, and I think part of our strategic plan is about working in fragile states. We see that as concerns niche, what we will be distinctively good at. Very difficult job trying to do research in these most difficult environments like Eastern Chad or Darfur or wherever. But we want to do that. That's what our ambition is. And we want to build on our strengths, which are we're grounded, we're practical, we're thoughtful. People say as Irish we have a sense of humour and we're very flexible. I hope that's true. So that's it. I think it's just to give you a sense of direction of travel of the organisation and give you a sense of the kinds of programmes we're trying to run. So Tom, do you want to say a few last words?
Well, just a very few. I mean, I think we've attempted between us to give you a sense of what we think are some of the more important pieces of work we're doing. But, I mean, I really would like to put it in the context of the moment we're in. This 2013, for a variety of reasons, has a number of opportunities to shape future policy, to take political decisions. So it's a moment of opportunity that we, as all, I suppose, in the same business, really need to think about and to capitalize upon. Because if we can get it right in this year about the right political decisions, the right policy frameworks, we've a lot more governments in developing countries have a policy framework which makes sense at the moment than there was 2 or 3 decades ago. We actually have an opportunity over the next decade to make a serious impact on hunger. Now that's the dream, that's what's the opportunity, and that's why, you know, I really am happy that we have a chance today to be with you here in the bank, given that the bank has contributed so much to changing thinking and policy over the last number of years, and I think has the huge potential to continue to do an awful lot of good work over the next years and decades. Thank you very much.
Thank you to both of you for a very inspirational, but also at the same time very practical and operational presentation. I think it had everything in it that the people in this room were looking forward to. Can I ask someone at the back seat to switch on the light? I don't think our discussants have PowerPoints, right? So we'll spend a few minutes listening to our 2 discussants. First, Tijen Sala, who is a sector manager in our Africa region. He oversees a large number of operations in Africa and African countries, and will share his views. And then later we will turn to Victoria Quinn, who is a senior vice president and a nutrition specialist with Helen Keller International. I'm sure you will say a few words about Helen Keller as well. Tijen, please. Maybe we can switch off the, let me find the button here. Tijen, go ahead.
Yeah. Oh. Very, very interesting presentation and quite inspiring. When I was a young man, and I'm still young, but I'm middle-aged now. But when I was much younger, going to high school in the Gambia, I studied under Irish Holy Ghost fathers, the very same fathers who founded Concern. In fact, many of them at the time in the 1970s had just come out of Nigeria from the Biafra War. And so they brought a very, very incisive understanding of the challenges of hunger, food in particular. And in many of the classes we studied in literature, studying the Bible, the Old Testament, New Testament, the issue of hunger and distributive justice was very core in the sort of things that they taught us. Later, of course, when I came to this country and studied, one of the things that was quite important was reading Maslow's hierarchy of needs, which I'm sure many of you who've studied psychology or so on may have come through. But Maslow in particular emphasizes a lot on humans start with meeting their basic needs, food and so on, before they go to higher order needs and so on. And I think the issue of food is not only an economic issue. I think it's a human rights issue. When people don't have food, they have it difficult to work. I mean, they don't have energy. They have difficulty to think. And this thing is even more debilitating when you're dealing with at the level of children, you know, who happen to be in a situation not be out of their own choice, but then just happen to be born somewhere. So, I mean, what distinguishes a child born into a royal family with all the needs and a child who basically happens to be born in some remote backwood in Ethiopia? I mean, why is one child having access to all the needs and all the wants, in fact, they have, while this child? So I think it raises a lot of questions for us. Now, listen to this presentation. I think it's a very important one, because I think food is very core, at the very core of the development agenda. And I think as I listened to the presentation, a number of things came to mind. One is that we have to work towards selling the agenda to governments. And how do you do that? You have to have the evidence. And this is why I think the evidence is very important. But even in selling it to governments, we have to know what area of government is the critical entry point. One is to get the leadership in countries, but more so important even is to get the Ministry of Finance. And usually we have this dialogue on food bouncing back between Ministry of Social Welfare, Ministry of Health, Ministry of Agriculture. But I think the agenda has to be really made at the center with Ministry of Finance. And I think that is where maybe organizations like Concern, working with institutions like the bank, which has enormous sort of leverage with governments, can be quite important, because Concern works at the very, very local level, working with communities and so on, and the bank works usually at a very higher level, but of course maybe in our project intervention with a lower level. I think working with an institution like the bank can help a lot with regard to pushing this agenda. The other thing that I heard, I think, in the presentation is that Concern and many of NGOs of its type, they do a lot of pilots. And a lot of these pilots tend to be a lot of small scattered, are quite important with some of the lessons that they are learning, but the evidence is not gathered and so on. And there is also the challenge of scaling up, because they have resource constraints. How can they work, I guess, with institutions like the bank and so on in scaling up agenda? I think it's an important one. The third one, I think, relates back to my first point, is the whole issue of inter-ministry coordination. And I think this is why I think the Ministry of Finance is very important, because in many of the countries we work in, they are the sort of inter-ministry coordination agency. So having the agenda, the issue of hunger and nutrition very much at the core of public investment programming could be quite important, and so on. Now, on what I had is the whole issue of, I think, building alliances and so on. I think institutions like Concern, and I think we need to work together in a public awareness campaign, I think, using evidence. I think the bank, given its own also enormous capabilities in doing analytical work, can help a lot in terms of working with institutions like Concern in scaling up. So that's all what I have to say. Thank you.
Hi, good afternoon, and it's a real pleasure to be here today. Thank you for inviting me. And I'm Victoria Quinn. I work with Helen Keller International. We're another civil society organization, and we fight blindness, and we fight against malnutrition using, again, the evidence-based solutions. And this is what we're hearing today. We have the evidence, we know what to do, and my agency is very much involved in 22 countries around the world in Africa and Asia, working with Friends and Concern and a lot of other different groups. So just a little background about Helen Keller International. First of all, just like Tom said, I'd like to thank the World Bank for the really amazing work you've done since we were talking about a few years ago the broken nutrition architecture. And the bank really helped to catalyze and mobilize attention to address that. And there was a lot of tenacity. I know Mira spent a lot of long days working on this with other colleagues in the bank and other agencies in civil society. And I think, you know, quite honestly, I'm not sure we'd be where we are today without the role of the bank. I think that really needs to be underscored. I'd also, as my last name is Quinn, I clearly have an Irish connection. I'd like to thank the Irish government, and especially the 2008 Hunger Task Force report, which is one of the best documents that's really out there. It really precipitated more documents from other countries thereafter, but the Irish Hunger Force report really put down in very clear terms what was needed, not just needed to be done by Ireland, but also at the global level. And that's really set out a blueprint for us all. And clearly, Tom was very active on that, and that's when I first got to know Tom. Now, turning to Concern, which is one of our favorite sister agencies for Helen Keller International, and turning to Tom, one of my favorite development partners, just to say thank you for really unflagging commitment, standing steady, never wavering. I don't know how many airplanes you've been on in the last few years. You must have a lot of air miles, and I hear Aer Lingus might be naming an airplane after you, but I'm not sure. That's just a CNN rumor. In terms of Helen Keller International and Concern, we share a lot of priorities, and one priority is conducting operational research and in establishing the evidence base, particularly around the area of agricultural programming for nutrition. So my comments will really be focused on the RAIN and the Realigning Agriculture for Improved Nutrition presentation today. And what we know in the whole area of ag and nutrition programming is the evidence base is quite frankly very scanty. And I'm hearing folks say, well, there is no evidence that agriculture improves nutrition. And quite frankly, that's true. There's very little evidence, but there are reasons for that. And because I know my audience today is comprising some agricultural experts, I want to put forward what I believe some of these reasons to be. And it's based on two very good reviews. You can ask me for the references later. One by Jeff Leroy at IFPRI and another by Massett et al. That has looked at many, many different ag nutrition programs and tried to peel apart what is not working. We have to pay particular attention, and I think Tom and Concern and the team there has with the RAIN project, in the design of these programs. Producing more food isn't the answer to malnutrition. It's a very important component. So we have more food at the national level, regional level. People need to have access to that food. But even if families have access to the food and there's household food security, so we have the food bit taken care of at the household level, we have the next thing, the care bit. Are mothers and young children actually receiving the food they need to receive, the optimal breastfeeding, complementary feeding practices? So we have food, but we need the care bit. And there's a third bit that we need to take care of, and that's health. Do these families have access to adequate health systems to ensure the food they ingest is utilized by the body and isn't wasted in fever or diarrhea? So when we design these programs, we have to very firmly look at the food aspect, the care aspect, and the health aspect, not just focus on producing more food. And this is why we haven't seen the impact that we've really wanted to see. Another related issue is our monitoring systems have not been robust enough because of a lack of resources. I think that came up in the presentation. So in addition to better design of programs, we do have to, at least in our flagship programs, Arnold was mentioning, we do have to invest in rigorous monitoring and evaluation, using wonderful partners. When you're a CSO group, you turn to IFPRI and other wonderful partners, and because they do have the expertise and know-how in this area. So once we're able to build the evidence base, then we'll be in a position better to advocate for more investment in the agricultural sector that works to improve nutrition. Relatedly, and it came up in some ways in the presentation today, there are other critical issues if we look at ag nutrition programming. How long the programs are. We're driven by donors who really want quick results, so we get 3-year program cycles. We're not going to see any results. 5 years minimum. I don't really know the golden amount of time needed, but at least 5 years we need to actually be able to implement programs and see results. Gender considerations, clearly, but not just empowering women. We have to work out what the relationship is between men and women and how that interface changes over time in terms of who controls resources, who wins and who loses. What are the short-term impacts for nutrition and possible long-term negative consequences? So building in gender from the beginning. And we're learning more and more now, a third area that's really important in the nutrition community, the role of hygiene and the disposal of human feces. We're seeing that children are sick, they're getting gut enteropathies, and all the food that goes in comes out, and nothing is used for building the body up. Instead, these sicknesses are stunting our children's growth. And this is an area we don't know enough about when we put our programs together. And just to end up, 2 more points. When and to step back a little more, when we're talking about this type of research and looking at the countries in which we work, looking at national capacity, how do we develop that capacity to undertake this sort of action research? Now, it's very exciting now with the Scaling Up Nutrition movement that we have countries actually indicating costed budgets to invest in nutrition. These are for nutrition-specific actions. I'm not aware of being integrated into these budgets, what it's going to cost to develop the nutrition workforce of these countries, including on the training side and research side. And that's really important. If we don't invest now on that, and it's not a sexy thing to invest in because you don't get quick results, we will be here in 20 years' time talking about the same issues. To wrap it up, I think Tom's absolutely right. We have an amazing opportunity here, 2013, where the stars are aligning, the Scaling Up Nutrition, the G8, the MDGs around the corner. There are a lot of opportunities to put more fuel in our tank to take this serious focus on nutrition further. But we need the bank also right up there to do it. You've done such a marvelous job so far. This is really critical with the new agricultural policy that was mentioned today to build these considerations in. So that's very exciting. And I wish I had a glass of whiskey and I can give a toast to Tom because he has done such a wonderful job, but I don't see a bottle of whiskey in the room. But I'll just say verbally thank you, Tom, on behalf of my organization, certainly. I know Concern, the team there will miss you, but you're in the genetic DNA of that civil society group. And we know we still have you in the Sun Lead group, and you'll be very active there. So that keeps us happy. But it's a pleasure, and thank you for inviting me today.
Great. Thank you to both of you, Tijen and Victoria. Why don't we move our chairs? Can you move a little bit? So we have a bit more than 30 minutes for questions and answers and comments. I mean, as we've heard before, this is really an incredibly important moment in this whole conversation. We have never had the world so focused on the whole issue of food security broadly. Top leadership around the world is paying attention to it. Now is the moment to get it right, not repeat what we have done in the past, but put these pieces together. And what I said earlier, we at the bank are listening to you. You know, I've heard it now over the last 1 or 2 years, what we should be doing more of in the agricultural sector, and we will change the way we work in agriculture. We've changed the way we work with regard to putting women at the center of our agenda over the last 3 years. We have now 98% of our operations have a gender-informed design. Many of them have gender-segregated monitoring, etc. We are in a very different place today than we were 3 years ago. In 3 years from now, we will be in a very different place when it comes to the nutrition agenda. That's a commitment we will make on our side in that sector, and Mira is smiling. The other thing I want to say, you know, I'm really impressed with your acronyms, Tom. RAIN and CRAM and SAM and SURGE. We can learn a lot from that, not joking aside. Let me open it up. Any comments, questions? Please, feel free. You covered it all, it seems. Yes, please, in the back. Is a mic? Yeah, there's a mic stand. Can we move this in the middle? Could somebody move this in the middle? You cannot? Oh, because of the videotape. Could you just move over there? Thanks.
Okay, I'm Howdy Buis from Harvest Plus, and I'm not going to make a comment about biofortification. I'm going to speak as an agricultural economist who's been working at IFPRI for the past 30 years. When we don't see improvements in nutrition and agriculture, I'd like to talk about food prices. Non-staple food prices, the foods that give quality in the diet, those prices have been going up for the last 50 years. We talk a lot about, when we talk about the food price spikes, what really happened was that the prices of food staples went up. They went down over a long period of time and then recently went up. When we talk about hunger and food prices, we're always focusing on staple foods. But non-staple food prices have been going up for the last 50 years because we haven't had the productivity increases for those foods that we have had for cereals. So the price of vitamin A has been going up for the last 50 years, the price of zinc has been going up for the past 50 years, and the price of iron has been going up for the past 50 years. And I think we have to be aware of that. If we expect to see improvements, we've got to do something to reverse that trend. Thank you.
Thanks, Tom. Do you want to comment on that? Or?
No.
We'll collect a few of those. Please. Ladies and gentlemen, please. Yes, please, in the back. And then Mira.
I would like to hear a bit more about your experiences in the intersectoral collaboration. Was the idea of involving the Ministry of Finance. What we've seen in working with agriculture ministries and trying to link them with the health in a joint agenda for nutrition is that agriculture inherently sees this as a health problem, and within the health agendas of the ministries, nutrition is at the bottom. No? So what are some of the things I was interested in looking at how you brought those coordination at more at a local level, and what has worked in your experience with that?
Thank you for the question, Mira. I mean, we all know there are no ministries of nutrition in none of the countries, and that is an issue, right? So it falls between the cracks. And I'd be very interested to hear how you see it, because we also have a lot of experience with this issue. Mira.
Yeah, thank you, Mira Shaker from Africa Health. Thank you, Tom, and everybody else for a really fascinating conversation. These conversations are very rare in the bank, so if I'm smiling, it's because you made my day, maybe my month, and hopefully my next 3 years, if Jürgen delivers on the promise that he just gave. Two questions and then a comment. A question, Tom, for you on... Actually, one question and two comments. On the EC declaration, the recent declaration, which is a very high-profile declaration from the EC, which we don't usually see, them committing to a 10%, publicly committing to a 10% reduction in stunting. What role has Concern and or the Irish played in that, and what role do you anticipate playing in helping them achieve that, and what could we as the bank help with in that this thing? And then two quick comments. One on the question of the pilots that Colin, you referred to. Usually when somebody says pilots, my brain goes just bzzz, okay. And I think many of us suffer from a problem called pilotitis. We love to do little pilots here and there, but what you presented was a really wonderful way of designing pilots to scale. So from day one, you think about what will it take to design a pilot that can be scaled up, and that's a very different mentality. And so I think there's a lot that we at the bank as well can learn from that approach. Lastly, a comment, Victoria, to your comment that very few country plans actually include costs for training people. I think that's a really important issue. And we are actually supporting somewhere from 6 to 10 countries in Africa to develop these costed action plans for scaling up nutrition. Mostly focusing on the health sector, primarily because that's where we know what to do. But in certain countries, in Nigeria, for example, last month, they want to do something through agriculture as well, and maybe even social protection. So we will help them develop these plans, and we are actually making sure that we do include a component that costs the training and capacity development elements there. Thank you.
Thank you, Mira. I'm going to hand it over to Tom, and then also the other discussants and presenters, and then we'll go for the next round.
Okay, I'll just comment on a couple of those things, but Conal will deal, I think, with in more detail with the issue of intersectoral collaboration. I mean, and the role of finance. I think ministries, I mean, this obviously is a problem. I think one of the potential side benefits of the sun is that if sun is getting a higher level of political prioritization in countries, that there is going to be more pressure on to have more effective collaboration, that, if you like, nutrition is actually taken in as a national priority and allocated resources, and perhaps have coordination mechanisms assisted than otherwise. And part, I think, of the role of the lead group is to look at experiences in among the 33 Sun countries, see where things are working, publicise that, celebrate that, and move on. But Connell may be able to elaborate a bit more on aspects of what we're learning about the intersectoral collaboration in Zambia. On the Mira's question about the EC declaration, I have to admit we didn't have anything to do with that initial declaration by Commissioner Peebles. He made it, I think, to the surprise of his own officials as well, at the Downing Street Hunger Summit in August, which I was at. But it being made, now of course you have to find ways of implementing it. And I think part of the discussion in the next couple of months will be precisely that. There is a meeting to be held in Brussels on the 14th of March, where the measurement systems under the sun is going to be at the heart of that meeting. So I think out of that, if you like, unexpected political commitment is going to come real potential, and it's up to us now to just capitalise on that. Colonel.
Sure. Thank you very much for the comments. Just on the intersectoral collaboration, I don't think there's any simple answer to that. I think we all know that nutrition has been an institutional orphan, and I don't think the parenting is too easy on it. We had long discussions, I suppose, about how would we get the ministries to align in Zambia. And we had a lot of discussion about kind of where the entry points are. Was it at national level? Was it more locally? And I think, what we did with IFPRI at the time when we were doing the formative research is we tried to get the